I'd like to thank the Washoe County Democratic Party, the Nevada State Democratic Party, Organizing for America, and HCAN for helping us put together this student event. It's time for students to learn about healthcare. It's time for us to understand that it's our debate, it's our money, that it affects us, and most of us would not have healthcare if we were not a student today. First off, I would like to bring up Gracie Geremia, our ASUN student speaker of the Senate. Gracie, can you please come up?
Hey everybody. So today, 30% of youth are uninsured, yet we make up only 15% of the population. We're the largest population that are uninsured among the 47 million Americans that are uninsured today. What happens after you graduate and you don't have insurance? What happens when if your parents lose their job and you don't have insurance? Not only are many Americans uninsured, but the quality of insurance we now receive is very poor. Breast cancer is among one of the leading cancers in the nation, but 28% of women have not received a mammogram in 2 years. Insurance needs to include preventative services. Promoting health care and health insurance reform will work to create a system that can help prevent illness before it occurs, before it's too late and costs more. This March, a close friend of my family recently passed away because he was in between jobs and didn't have insurance. So he had cancer that spread from his lungs to his entire body, and he had no way of getting treatment. Things like this are not okay. Your socioeconomic status should not depend on whether you receive insurance. So together we can prevent this, and together we can make change if we mobilize the student body. Thank you.
Thank you, Gracie. The next lady who's coming up is Theresa Navarro. She's the director of Healthcare for Now for America. And Theresa is an amazing woman. She's a huge advocate of healthcare, and she understands why we need healthcare reform.
Thank you very much for being here. I really appreciate it. Healthcare is right now the #1 issue that we are fighting. Healthcare for America Now was formed back in 2008, prior to when Obama was still a candidate, and he promised Healthcare for America Now organization that he became president, he would keep healthcare at the top of the issue as the #1 issue when he came into his administration. Here we are. He kept his promise to us. He kept healthcare as the #1 issue, and that's where we are right now. One of the things people have to know and you have to understand is that people talk to me all the time, it's like, we just didn't start recently fighting healthcare. Healthcare has been fighting over now for 100 years. We had, when you look at it, Roosevelt started it in the 1900s, FDR started it in the 1930s. We had L.B. Johnson, who passed Medicare and Medicaid in the 60s. We had the Clintons in the 90s, and here we are in 2009, and we are now fighting it. We have gotten even farther now because we have 3 House committees in the House right now, and a committee in the Senate that is fighting for the healthcare reform, and that's what we're trying to do. And Healthcare for America Now is pushing for quality, affordable healthcare for everyone. When we talk about the insurance and the people that are uninsured, when you talk about over 50 million people that are uninsured, we're not talking about, people always say, it's just all the poor people. It is not. The lower class people, they are getting a Medicaid service. They may not be the best, but we want to revise that. The older people are getting the Medicare service. We want to revise that so that it can all be comparable and balanced as one huge, large insurance for everyone. It's the middle class. It's all of us. And the other thing that you need to know is, the girl talked just a little bit earlier about someone dying from cancer, because had no service. We are paying for the emergency system. In the emergency system, nobody wants to talk about the billions and billions of dollars that we are spending in the emergency care that we are paying for as taxpayers, as students. When you pay taxes, that's what you're paying for. And the people are dying. People are dying daily because they have no care at all. We are looking for no pre-existing conditions. Everybody deserves health care in this country. And I just want to tell you that one thing, I have a client that he has been on a national, I pushed him for a national. He had insurance, a small business, 6 people in his company. He had great insurance for all of them for 2 years. And then his wife got pregnant and she had a baby. After 9 months after the baby was born with a cleft lip palate. So 9 months later, the insurance company cancels them and tells them that they had to cancel them because the baby had a pre-existing condition. How does a child, an unborn, have a pre-existing condition? How do you insure a child when you're still not even born yet? Those are the issues that are going on with the insurance companies. Insurance companies in 2000, there were over 400 private. In 2008, there's 27. We have a monopoly going on in this country with the insurance companies, and we need to get rid of that. And the only way to do that is to get a public health insurance option for all of us. And I just want to tell you the very last thing. Right now, Healthcare for America Now, today and tomorrow, is calling Senator Reid's office. There are some flyers here if you could call. If all of you would today pick up your cell phone, make one call to the senator to push for the healthcare for insurance for all of us, I would really appreciate it. Thank you very much.
Worked so hard to put on this great rally. This is a very important day. We are resetting the debate on this very important issue. And similar to just how important the students on this campus played in electing Barack Obama to the president, winning Nevada for him, you play a crucial role in this debate and this discussion. And I know it can be difficult to think about healthcare in terms of your future challenges with that, but let me just share my own story. I went to school, did all the right things, got pretty good grades, got a nice job afterwards, got married, and my wife and I, even with health coverage, when our two twins were born, we didn't know we were going to have twins, we weren't planning on that, they were born 9 weeks early. 9 weeks early means you go into the neonatal intensive care unit, which is incredibly expensive care. Even with coverage, folks like us, parents like us, are dealing with incredibly expensive medical bills, and we'll be dealing with those bills for years to come, likely. So when you hear people talk about, oh my gosh, we're going to have rationing, oh my gosh, we're not going to have choices, that's ridiculous. That's the situation that we've got right now. We've got rationing in place. That's why we need real healthcare reform. That's why we need it now. And that's why I'm glad that you're all here to send a strong message back to Washington that enough is enough. This is the issue that we need to deal with, and we need to deal with now. Thank you.
Oh my goodness, we can't have a public option. What would a public option do? And I'm a strong believer in the public option, and I'm going to make that phone call to Senator Reid today to encourage him to stand tough on this. The main reason health care costs are spiraling out of control is lack of competition. I heard on NPR this morning there's a southern state, I forget which one, where 90% of the market is controlled by one healthcare company, Blue Cross. So in that state, you get Blue Cross, or pretty much you don't get any health care. That's who you have. We need competition. Why do you think the insurance companies are so afraid of a public option? Competition! Competition, I thought, was the American way. I thought that was the Republicans who always said we need more competition. And here I am as a Democrat saying we do need competition to bring the prices down. Healthcare costs are completely out of control, and we all pay for it. And when people don't get health care in this country, when they're really, truly sick and they have an emergency, they go to the place that costs the most. The place that costs the most to get health care, the worst possible place you should be going for your routine health care, emergency rooms. And you know the number one reason people go to emergency rooms in our country?
They don't have health care.
Ear infections. Kids who have ear infections. That's the number one reason people visit emergency rooms. Does that make any sense that we're using our highly trained, wonderful emergency rooms to treat ear infections? No. So please get involved. It's your future. You may have health care now, but once you graduate, good luck to you. We owe it to you to make sure that you have access to affordable, quality health care in the future. And may I just say, as a senior Democrat, I'm term limited, nothing does my heart more good, and David's not quite as an old Democrat as I am, but to come to a place and see a bunch of young Democrats here turning out. You're the future. We all know it. We owe it to you to make sure health care reform happens now. Please get involved. Please don't leave it to the rest of us. It's going to take all of us contacting our representatives, and even those who represent us, like Congressman Hillard, who don't believe in health care reform. Make sure you contact him, because otherwise he'll just say, oh, everybody in Nevada thinks health care is just fine the way it is. If you think health care is fine the way it is, don't do anything. But if you're like the rest of us who think that friend of my work colleague deserves access to chemotherapy for her cancer, please do something about it today. Thank you.